Hi and welcome to today's video. My name is Natalia Munoz and I'm an occupational therapy student, and we're going to be talking about the differences between communicating with the parent of the child we're treating and how can we communicate with the child during our therapy sessions. So as occupational therapists, we're trained to look at fine motor skills, visual motor skills, sensory processing skills, and bilateral hand coordination. These are all terms that we understand within the healthcare community. But when we're talking to a parent, sometimes they don't have that education in the healthcare field that we have. So when we're talking to the parent and we're discussing what are their goals and what are we trying to help the child in our sessions, it's very difficult for them at times to understand, oh yes, we worked on fine motor skills. Okay, but what are fine motor skills for the parent? So instead of saying we worked on fine motor skills, we can address, we worked on the child's ability to manipulate small items, to build a tower with both hands. And what this is going to do is that it's going to help the child eventually be able to use both hands to do buttons or to tie his shoes or to hold a plate and then feed himself, because he's using both hands at the same time. Another activity that we tend to do also is have the child prone on a scooter board. And for us, we're working on upper body strengthening, we're working on neck control, bilateral hand coordination. So in a way to explain why we're doing this for the parent is just to tell them, listen, we had him laying down on a scooter board and we had him propel around a little obstacle course so that he can go from one side to the other, and that's going to help strengthen the shoulders, strengthen the back, and eventually this is going to help for handwriting, because it's always good to relate it to functional. There's no good or bad about not explaining what we're doing it, but for them, once you relate it to something that they need to do, they will understand better. They will be more accepting of the activities. For instance, when they play bingo in a session, a lot of parents are going to be like, okay, you play bingo, but what is so important about bingo? What you can tell them is, it's going to help them to find items, identify letters, and be able to locate numbers and letters easier and faster. And that is going to help them when they need to read, because they're going to be working on visual skills so that they can read and stay on the line or not get lost. Again, related to function. So explaining to the parents what are we doing and why are we doing it, it's very important. They need to relate it to real life activities. A lot of times we say, oh yes, we're building a tower with the blocks, but we're really having the child work on so many things that for the kid, when you're in session, you can tell them, okay, let's build a tower, and I have a little improvised blocks. So you're working on visual motor skills, you're working on fine motor skills. Can they use a radial grasp? But also, do they have the control to stack and not knock it down? Do they need both hands, one to stabilize the tower and the other one to put the block on top? But what I like to do if I'm working with a child is make it fun. Okay, we're gonna make a big house. Can you help me? And then we're gonna say, okay, have the block go on top, and I try to do an intonation so they find that it's fun. You're not just putting the activity in front of them and having them repeat it over and over. I also like to make it fun where you can have a little toy and tell them, okay, let's make a house for the little man, and then help me go on top, and then you're working on what you want them to do, which is the bilateral hand coordination, visual motor skills. And at the end, you put the little man and you say, okay, let's knock it down. So it's entertaining for them. They feel that they are part of it. When we have the child go prone on the scooter board, which was the other activity I spoke about, I make it fun as well. Let's have a race. You can be part of the activity too. You can be on the scooter board and say, okay, let's see who's gonna win. Or maybe let's pretend that you're on a surfboard and we're swimming on the water, because for them the activity sometimes is very strenuous and they're gonna get tired, and if you don't make it fun, there's no point of having them participate, because they're gonna say flat out, no, I don't like it, I'm very tired, I don't want this, or they're gonna cry. So give a purpose to the activity. Pretend that you're in the water and you're swimming on the water and that's your surfboard, or pretend that you're in a race, pretend that you are on a boat and you need to swim to shore. So make it fun, make it entertaining. It's their occupation. Play is a child's occupation. Play is the way they learn and they master skills. So that's why it's so important to relate to them in that sense. Now the other activity was playing bingo. Obviously you're not going to give a child the bingo that an adult will play. A lot of times those bingos for little ones come in with little pictures instead of numbers, or you're going to show the child the letter and say, okay, I spy with my eye, letter B with the heart or the circle, and you're going to have them play. You're going to have them, let's see who's going to win. It's always fun for them to be, especially when they're in the competitive stage, that okay, I'm gonna win, or let's see who finds it fast. It's always important to have them feel that they are part of the activity. It's not something you're imposing on them. And there's research that shows that parent training is very important. And in the article, actually, the parents reported that sometimes the therapist is so trained to work on the goals for the patient that even though it's client-centered and they're asking the parent, what do you want me to work on, they're not really listening to the parent and their concerns, and they're being more clinical. We're working on this, we're working on that because you want him to be able to dress himself. Okay, but explain to the parent why you're doing it in normal language. You don't need to be a clinician when you're talking to the parent at all times. That way they will learn, they will understand why the child has difficulties to complete an activity and what activities are more beneficial for them, and why you're doing a tower with a child or a train with the cubes. And then also there was another article that I read, and it talks about how it's very important to have the children be part of the activity and feel that even though you present the activity, they are in control, because they have a say as to, okay, let's play bingo, but I want to pick the letters and the numbers. Okay, you can transition the activity in that sense. You're still working on visual motor skills, you're still working on play skills, you're still working on cognitive skills, because the child needs to identify that letter and that number that they retrieved, or the picture that they retrieved. So yes, we are client-centered. We want the child to feel part of the activity, but we can't always talk to the parent and the child the same way. We have to relate to them, and we have to put ourselves in the same position as they are. Parents don't always understand our medical terminology, so it's important to explain to them the purpose and relate it to function. And for the child, it's always about play and fun. This is the only way that is the easiest and more efficient way to have a child learn and want to participate, because this is their true occupation at this age. Okay, thank you for listening.